Hello, good evening. We are glad you could join us for this special edition of Doctors on Call. It's a program which comes to you every second Sunday of the month, and it's really special to us because, guess what? Today, we are marking 5 good years since Doctors on Call was initiated, and we are really grateful to God because of the far that He has brought us. We are also grateful to all our partners out there and all those who have supported us, who have given us even financial support to keep Jesus on the airwaves and even to keep this wonderful program on the airwaves. Keep it up. And even we are glad to our doctors, our panel of doctors, who have also been able to help us even in this program. And what normally happens to this program, we normally bring you a panel of medical doctors in the studio, and not just quacks. We bring you experts in the studio to tackle all your medical issues. And today in the studio, we have Dr. Catherine Mutisya, who is a clinical psychiatrist, and we also have Dr. Collis, who is a food specialist, and we also have Dr. Casey Wafula, who is a pediatrician, and we also have Dr. Bridget Monda, and we have Joanne, who is in Studio B, and she's ready there and to pick up your questions. And what happens? So keep on calling and sending in those SMSs to 4316, and you can call us on 4200 600. And right now we are going straight to the profiles. We'll have a profile of Dr. Catherine Mutisya, who is a clinical psychiatrist.
Dr. Catherine Mutisya, clinical psychiatrist. A clinical psychiatrist is a doctor specialized in mental health. She did her Bachelor of Medicine and Surgery in the University of Nairobi and her Master's in Medical Psychiatry in the same university. She has been practicing for 13 years. On a day-to-day basis, she sees patients with mental illnesses like depression and anxiety, drug abuse, relationship problems, sleep disorders, among others. She sees more women than men, as women seem to be more predisposed to mental illnesses. Her greatest satisfaction is seeing people who are ill coming back to her cured. She is located at the Mathare Mental Hospital and runs a private clinic at KMA Center, Mara Road.
Thank you very much, Dr. Catherine Mutisya. But you know, most of us confuse. Most of the people will always confuse to differentiate between the role of a psychiatrist and a psychologist. What's the difference?
Actually, psychiatrists and psychologists work together. But a psychiatrist is a medical doctor. You have to be a doctor first before you can now specialize in a master's in psychiatry. Psychologists do not necessarily have to be medical doctors. You train in psychology, bachelor's degree, then you can go ahead and do a master's in psychology. There are different fields. You can do counseling psychology or clinical psychologist or educational psychologist. But we work in and together. Psychiatrists will prescribe medication and can also give psychotherapy. Clinical psychologists mainly major in psychotherapy. But both professionals will prevent and also treat mental illnesses.
Okay,
yes.
Thank you very much. Welcome to Doctors on Call. And up next is a profile of Dr. Collis FB, who is a food specialist or a podiatrist.
Collis FB. He is a podiatrist. A podiatrist is a doctor specialized in the care of the foot, ankle, and lower leg. Collis has a degree in podiatric medicine from British School of Surgical Podiatry in the UK. He has been practicing for the last 10 years. He currently works at the Kenyatta National Hospital and offers voluntary services at the Kikuyu Hospital. On day-to-day basis, he sees patients with sports problem on the foot, patients with walking problems, and diabetic patients who need foot care. His greatest satisfaction comes when he saves a person's limb and a person does not have to undergo amputation. His advice on foot care whenever you experience any pain or problems with the foot is to always seek proper medical attention and always make sure that you wear proper footwear. He currently runs a specialty clinic at Unga House in Westlands.
Thank you very much, Dr. Collins. And you know, the trend of wearing high heels is becoming an addiction, and mostly to women. And I don't think, and they look so wow, they look so wonderful in their heels, but maybe they don't know the side effects on the other hand. But I'm wondering, does it happen in men? How come it's women? Do men wear high heels?
Well, let me put it this way. The average woman owns 25 to 30 pairs of shoes. The average man owns only 4. So fashion dictates, and so a lot of times women will want to wear fashionable shoes at any time. Men don't really care. So men, it's changing. Current trends are changing a little bit now. Men are going to more of a higher heel, but they're still not an excessively high heel, which is going to put trauma on the foot and create other problems.
And for instance, let me ask you, how many pair of shoes does your wife have?
My wife probably has about 65 pairs of shoes.
And you?
About 4.
Thank you very much for joining us on Doctors on Call. And up next is a profile. Remember, we have a pediatrician here with us, and mostly parents out there, maybe they're crying, their children are just having running nose and they are coughing. We have a pediatrician right here with us, but let's have a look at his profile first.
Dr. K.C. Wafula, pediatrician. Dr. Wafula did his first degree studies at Makerere University, Kampala, and his postgraduate studies at the University of Nairobi. He has been practicing since 1991 as a pediatrician. He also has a special interest in children with sickle cell disease. His greatest satisfaction at the end of the day is to put a smile on his patient's face. He is based at the Aga Khan University Hospital, Doctors Plaza.
Thank you very much, Dr. Wafula. But you know what, with this kind of weather, I'm really feeling for our children, mostly the elderly and those with babies. Because of the weather, how can it be prevented? The coughing.
I think what happens during this kind of weather, a number of people get running noses and coughs. But I think the most important thing is to know that these are infections. Now, if there's an infection in a neighborhood and your kids go there, there's nothing much you can do. It's going to be difficult to tell them not to go to play around with the other kids. But we advise a number of mothers at the moment. There is a vaccine called a flu vaccine. And this, if you used it, it would actually prevent some of these coughs and colds that the babies are getting now. It's available in many of the private institutions, but it may not be available in the public institutions. The other thing to do is to know that when you have a cold as an adult, and you then go and visit a home where there may be a number of kids, you're going to leave there, many of those kids coughing and sneezing. So we encourage many of those with colds and coughs to minimize visiting other people who have children. Na kia pili, na kia muhimu, when you blow your nose, try and use not a hanky. Tissue is better, because once you blow your nose, you remember when we had this epidemic about swine flu, we were encouraged to blow our noses, pack it up nicely, the tissue paper, and put it somewhere where that possibly bean is covered nicely. Because when you blow your nose quite openly or in a hanky, there are chances that you're going to spread it to the other people that you're going to shake hands with, and possibly those next to you. So mothers and fathers must know that coughing and running nose is an infection, and in the simple terms, there's a term called chappy. Chappy means that if I have it and you get next to me, I'll pass it over to you. So even if you're in a home and you have a number of kids and you have a cold, minimize getting very close and sneezing na smooching, karibu karibu na watoto wale who are smooching on their cheeks. So many people think that during baridi time you get coughs and colds. No, you must get in contact with someone who has a cold in order to get a cold.
So meaning that kutembea, we put a curfew kidogo.
Yeah, well, if you have a cold, minimize visiting your brothers and sisters, because you're just going to pass over this cold. But especially in the early 48 hours, 72 hours, you're very, very infectious. Later on, you could possibly, when you're in a sneezing phase and...
Especially in the matatus, sometimes it's not possible, the way you are telling us, to just use your hanky, but maybe you're in a matatu and the person who is next seated to you, achia!
Yeah.
Achia!
These are the hazards of a matatu. Lakini bana, tutafanya nini bana? Matatu zitumie.
sasa Kiswahili chako wewe mwani, nikuulize daktari, kwani ulienda kuzaliwa huko pwani au vipi Mombasa? Wanipa compare
Wajua kila lugha nataka kila mtu anatazama leo ajue kwamba lugha ni kujifunza. If you don't talk the language, you can't learn the language. You got to like the language, talk, use it.
Thank you very thank you very much. And remember, we are also expecting to have Dr. Bridget Monda, who is a gynecologist. She's not yet here, but we are expecting to have her here. And remember, as we mark 5 years, this time round, we are giving back fruit baskets to women who have just given birth. That's good news. Courtesy of Tuskies. And remember, keep on sending in those SMSs to 4316, and you can call us on 4200.